After 60, the body doesn't usually collapse overnight. It whispers first. Small changes appear, quietly and slowly, often so subtle that they feel like just age. A little more tiredness, a bit of stiffness in the morning, slight dizziness now and then. Because these changes don't arrive with pain or urgency, many seniors learn to live with them, brushing them aside as normal. This silence is exactly what makes these health problems dangerous. They grow in the background, unnoticed, untreated, until one day they demand attention in the form of a serious illness. This video is about those silent health problems seniors often ignore after 60, why they are overlooked, and most importantly, how early awareness and simple action can protect health, independence, and quality of life for years to come. As people age, the body becomes incredibly good at adapting. When something isn't working perfectly, it compensates. Blood pressure rises slowly, so the body adjusts. Blood sugar creeps up gradually, so symptoms don't feel dramatic. Bones lose density little by little, so there's no pain until a fracture happens. This slow progression tricks the mind into believing everything is fine. Many seniors think, "I feel okay, so I must be okay." Unfortunately, many of the most serious health conditions don't announce themselves loudly in the early stages. They stay hidden, quietly damaging organs, blood vessels, and bones while life goes on as usual. One major reason seniors ignore early signs is mindset. After decades of life experience, many older adults develop a strong sense of resilience. They've handled illness, stress, work, and family responsibilities for years. Compared to past struggles, mild discomfort feels insignificant. There is also a deep-rooted belief that aging automatically means weakness, fatigue, or pain. This belief is dangerous because it normalizes symptoms that should actually be investigated. Feeling tired all the time is not just getting old. Frequent urination is not always harmless. Loss of balance is not something to accept without question. Aging changes the body, yes, but it does not mean surrendering health. Another powerful reason silent health problems are ignored is fear. Many seniors avoid doctors not because they don't care, but because they care too much. They fear being diagnosed with something serious. They fear becoming dependent on medication. They fear losing independence. So they delay checkups, skip tests, and avoid conversations about their health. Ironically, this avoidance increases the risk of exactly what they fear. Early detection often means simple treatment, lifestyle changes, and control. Late detection often means complications, hospital visits, and loss of independence. High blood pressure is one of the most common silent problems after 60. It rarely causes pain. Most people don't feel it rising, yet uncontrolled blood pressure quietly damages the heart, brain, kidneys, and eyes. Many seniors only discover they have hypertension after a heart attack, stroke, or vision problem. Occasional headaches, mild dizziness, shortness of breath while walking, or a feeling of pressure in the head are often ignored. These signs don't always mean high blood pressure, but they are signals worth checking. Regular monitoring, even at home, can reveal patterns long before damage occurs. Simple steps like reducing salt, managing stress, staying active, and following medical advice can make a massive difference.
Diabetes is another condition that develops silently over years. Type 2 diabetes often starts with insulin resistance long before blood sugar levels become dangerously high. Early symptoms can be subtle: increased thirst, frequent urination, fatigue after meals, blurry vision, or slow healing of small cuts. Many seniors attribute these signs to aging or weather changes. Left unmanaged, diabetes damages nerves, blood vessels, kidneys, and eyesight. Early detection allows seniors to control blood sugar through diet, movement, weight management, and medication if needed. Ignoring it allows silent damage that becomes irreversible over time. Bone loss, or osteoporosis, is especially dangerous because it is completely silent until something breaks. Bones don't ache as they lose density. Seniors may feel fine until a minor fall causes a hip fracture or spinal injury. Many older adults assume fractures are just bad luck, not realizing their bones have been weakening for years. Lack of calcium, vitamin D deficiency, hormonal changes, and inactivity all contribute. Regular bone density screenings, weight-bearing exercise, sunlight exposure, and proper nutrition can significantly reduce fracture risk. Strong bones are not just about avoiding pain, they are about preserving mobility and independence. Vitamin deficiencies are another overlooked issue. As people age, nutrient absorption decreases. Appetite changes, medications interfere with absorption, and diets become less varied. Deficiencies in vitamin D, B12, iron, and magnesium can cause fatigue, muscle weakness, memory problems, tingling in hands and feet, mood changes, and balance issues. These symptoms are often blamed on aging or stress. Simple blood tests can identify deficiencies early, and targeted supplementation or dietary changes can restore energy and mental clarity. Ignoring these deficiencies can worsen cognitive decline, increase fall risk, and weaken immunity.
Early warning signals often appear as small disruptions in daily life: trouble sleeping through the night, feeling unusually tired despite adequate rest, forgetting names or appointments more often than before, losing interest in activities once enjoyed, changes in appetite or weight without trying, shortness of breath during routine tasks. These are not emergencies, but they are messages. The body communicates through patterns, not crises. When seniors learn to notice patterns instead of isolated symptoms, they gain powerful insight into their health. Mental health is another silent area often ignored after 60. Depression and anxiety don't always look like sadness. They can appear as irritability, withdrawal, lack of motivation, or physical complaints like aches and digestive issues. Many seniors were raised to stay strong and avoid discussing emotional struggles. Loneliness, loss of loved ones, retirement, and reduced social interaction quietly impact mental well-being. Ignoring mental health affects sleep, immunity, heart health, and memory. Talking openly, staying socially connected, seeking counseling, and engaging in meaningful activities can restore emotional balance and improve overall health. Hearing and vision changes also develop slowly and are often ignored. Gradual hearing loss can lead to social isolation, frustration, and even cognitive decline. Vision changes increase the risk of falls and accidents. Many seniors delay eye and hearing exams because changes feel manageable at first. Early correction with glasses, hearing aids, or treatment improves safety, communication, and confidence. These senses are not luxuries. They are essential tools for staying independent and connected to the world. One of the most powerful tools for preventing silent health problems is regular screening. Blood pressure checks, blood sugar tests, cholesterol levels, bone density scans, eye exams, and vitamin level tests create a clear picture of health. These tests don't label someone as sick, they provide information. Information allows choice. Choice allows control. Prevention is always easier than treatment, and early treatment is always gentler than late intervention. Lifestyle plays a massive role in preventing silent conditions. Movement keeps blood vessels flexible, bones strong, and blood sugar stable. Balanced nutrition fuels every cell. Adequate hydration supports circulation and brain function. Sleep allows the body to repair itself. Stress management protects the heart and immune system. These are not extreme measures, they are daily habits. Small, consistent actions matter more than occasional big efforts. This is a great moment to pause and take action beyond just watching. If content like this helps you understand your health better and supports a stronger future, click the subscribe button now. Staying informed is one of the simplest ways to protect long-term health, and more practical, science-backed videos are on the way. Family support is also crucial. Seniors who feel encouraged rather than judged are more likely to seek care. Conversations about health should be open, respectful, and proactive. Asking simple questions like, "Have you had your checkup recently?" or "How have you been feeling lately?" can open doors. Health is not just personal, it's shared among families and communities. Ignoring silent health problems doesn't mean someone is careless. It usually means they are uninformed, afraid, or simply used to pushing through discomfort. Awareness changes everything. When seniors understand that early symptoms are not a sign of weakness but a signal for strength, they regain control. The goal is not to live forever, but to live well, with clarity, mobility, and dignity. Aging does not mean accepting decline without question. It means becoming more attentive, more informed, and more intentional. The body after 60 is still capable of healing, adapting, and thriving when given the right support. Silent problems only remain silent when they are ignored. When they are acknowledged early, they become manageable, often reversible, and far less frightening. In the end, the most dangerous health problems are not always the ones that hurt the most. They are the ones that quietly steal time, energy, and independence without being noticed. Listening to the body, respecting small signals, and choosing early detection over fear can change the entire aging journey. Health after 60 is not about perfection. It's about awareness, prevention, and the courage to act before silence turns into crisis. Continuing from where we left off, it's important to understand that prevention after 60 is not about drastic change, strict routines, or living in fear of illness. It's about awareness and consistency. Many seniors believe that if they've lived this long without major problems, nothing serious will happen now. But the truth is, the body's repair systems slow down with age. Small issues that once fixed themselves can now linger, grow, and quietly turn into long-term conditions. This is why regular follow-ups and listening to the body become more important than ever. One silent issue that often goes unnoticed is declining kidney function. The kidneys work tirelessly to filter waste from the blood, yet they rarely cause pain when something starts to go wrong. Early kidney problems may only show up as swelling in the ankles, changes in urination, fatigue, or difficulty concentrating. These signs are frequently ignored or blamed on tiredness or weather. Simple blood and urine tests can detect problems early, allowing seniors to protect kidney health through hydration, blood pressure control, and proper medication management. When kidney issues are caught late, treatment becomes far more complex. Another overlooked concern is heart rhythm irregularities. Not all heart problems feel like chest pain. Irregular heartbeat, occasional palpitations, lightheadedness, or shortness of breath can come and go, making them easy to dismiss. Seniors may assume it's anxiety, indigestion, or simply moving too fast. But untreated rhythm issues increase the risk of stroke and heart failure. Early evaluation can prevent life-threatening complications and often requires nothing more than monitoring and medication. Digestive health also changes silently with age. Slower digestion, constipation, acid reflux, or bloating may feel annoying but harmless. However, persistent digestive changes can signal underlying issues such as nutrient malabsorption, medication side effects, or more serious gastrointestinal conditions. Ignoring these signs can lead to weight loss, weakness, and deficiencies that affect the entire body. Paying attention to digestion, fiber intake, hydration, and regular checkups helps maintain strength and comfort. Balance and coordination problems are another quiet warning sign. Occasional stumbling, dizziness when standing, or feeling unsteady on stairs is often brushed off, yet these issues can stem from blood pressure changes, inner ear problems, nerve damage, or muscle weakness. Falls are one of the leading causes of serious injury in seniors, and many are preventable. Addressing balance issues early through physical therapy, strength exercises, and medical evaluation can dramatically reduce fall risk.
Memory changes deserve careful attention as well. Forgetting where keys are placed is normal, but repeated confusion, difficulty following conversations, or trouble managing familiar tasks is not something to ignore. Early cognitive changes can be linked to vitamin deficiencies, sleep disorders, depression, or early-stage neurological conditions. Early intervention can slow progression, improve quality of life, and reduce stress for both seniors and their families. Sleep problems also quietly impact health. Difficulty falling asleep, waking frequently at night, or feeling unrested in the morning is often accepted as part of aging. In reality, poor sleep affects blood sugar control, blood pressure, memory, mood, and immune function. Sleep apnea, in particular, is widely underdiagnosed in older adults. Treating sleep issues improves energy, focus, and overall resilience. Another reason silent health problems persist is lack of clear symptoms in the early stages. The body compensates remarkably well until it can't anymore. By the time pain appears, damage may already be advanced. This is why routine checkups are not optional after 60. They are essential maintenance, just like servicing a car before it breaks down. It's also important to address the role of medications. Many seniors take multiple prescriptions, and side effects can overlap with symptoms of illness. Dizziness, fatigue, dry mouth, confusion, and digestive issues may be blamed on aging when they are actually medication-related. Regular medication reviews with a healthcare professional can prevent unnecessary complications and improve daily comfort. Social isolation quietly damages health as well. Reduced interaction affects mental health, immune function, and even heart health. Loneliness increases the risk of depression and cognitive decline. Staying socially active, even in small ways, supports both emotional and physical well-being. Health is not just biological, it is deeply connected to connection and purpose. The key message is this: silence does not mean safety. Just because something doesn't hurt doesn't mean it isn't harmful. The earlier a problem is identified, the simpler and more effective the solution usually is. Prevention does not take away independence, it protects it. Seniors who actively monitor their health often enjoy better mobility, sharper thinking, and greater confidence. They spend less time in hospitals and more time living on their own terms. Awareness transforms aging from something to endure into something to manage wisely. This stage of life deserves care, attention, and respect. The body has carried decades of experiences, challenges, and achievements. It deserves to be listened to now more than ever. Small signals today are opportunities, not inconveniences. By choosing early detection, routine screenings, balanced habits, and open conversations, silent health problems lose their power. Aging does not have to be defined by decline. With knowledge and timely action, it can be a chapter of strength, stability, and dignity.
As this journey continues, it becomes clear that one of the most underestimated factors in senior health is inflammation. Chronic, low-grade inflammation doesn't cause sharp pain or obvious symptoms at first, yet it slowly contributes to heart disease, arthritis, diabetes, and even cognitive decline. Seniors may notice stiffness in the morning, aching joints, or general discomfort, and assume it's just age catching up. In reality, diet, inactivity, stress, and unmanaged conditions quietly fuel inflammation. Simple changes such as anti-inflammatory foods, gentle daily movement, proper hydration, and stress reduction can significantly lower inflammation levels and protect long-term health. Another silent concern is declining immune strength. As the immune system ages, it becomes slower to respond. Seniors may find they get sick more often, take longer to recover, or feel drained after minor infections. These changes are often ignored until a serious illness strikes. Supporting immunity through proper nutrition, vaccinations, sleep, and physical activity is critical. A strong immune system doesn't just prevent illness, it preserves energy and resilience. Hormonal changes also continue later in life and are frequently overlooked. Shifts in thyroid function, cortisol levels, and other hormones can affect weight, mood, heart rate, temperature sensitivity, and memory. Because these changes are gradual, they are often mistaken for personality changes or normal aging. Blood tests can identify imbalances early, allowing simple treatments that restore balance and improve daily functioning. Dental health is another area where silence can be costly. Gum disease, infections, and tooth loss don't always cause pain in early stages, yet they are closely linked to heart disease, diabetes complications, and poor nutrition. Many seniors avoid dental visits unless there is severe pain.
Regular oral care and checkups protect far more than just teeth. They support overall health and confidence. Hydration is a surprisingly common issue. The sense of thirst diminishes with age, so many seniors don't drink enough water. Mild dehydration causes fatigue, confusion, constipation, dizziness, and kidney strain. These symptoms are often mistaken for other conditions. Making hydration a routine habit, not a response to thirst, supports nearly every system in the body. Muscle loss, known as sarcopenia, also develops quietly. Without regular strength use, muscles gradually weaken, affecting balance, posture, and independence. Seniors may avoid movement because they feel weak, but inactivity actually accelerates muscle loss. Gentle strength training, even with body weight or light resistance, preserves mobility and confidence. Strong muscles protect joints, bones, and the ability to perform daily tasks independently. Vision-related conditions like glaucoma and macular degeneration progress silently at first. There may be no pain, no obvious vision loss until damage is advanced. Regular eye exams are essential, even when vision seems good enough. Early detection can preserve sight and prevent irreversible loss.
The role of stress should not be underestimated either. Financial concerns, health worries, family responsibilities, and loneliness quietly elevate stress hormones. Chronic stress increases blood pressure, weakens immunity, disrupts sleep, and worsens inflammation. Stress is not just emotional, it is physical. Learning relaxation techniques, maintaining routines, and staying socially engaged can dramatically reduce its impact. Perhaps one of the most important shifts after 60 is learning to view health as an ongoing conversation rather than a crisis response. Waiting for pain or emergency signs often means waiting too long. Proactive care, even when feeling fine, is the smartest approach. Health checkups are not admissions of weakness, they are acts of responsibility and self-respect. Many seniors who begin regular monitoring are surprised by how empowered they feel. Knowing numbers like blood pressure, blood sugar, and cholesterol removes fear and replaces it with clarity. Clarity leads to better decisions, calmer minds, and stronger bodies. Family members and caregivers also play a vital role. Encouragement, patience, and support make it easier for seniors to prioritize health. Judgment or pressure often has the opposite effect. Health conversations should feel supportive, not alarming. As years advance, quality of life becomes more important than quantity. Quality comes from mobility, mental clarity, emotional stability, and independence. Silent health problems slowly steal these if ignored. Awareness gives them back. Every stage of life has its responsibilities, and after 60, one of the greatest responsibilities is listening to the body's quieter messages. These messages are not meant to scare, they are meant to guide. When acknowledged early, they lead to simple solutions and stronger futures. Aging is not the enemy, ignorance is. Knowledge transforms fear into confidence and uncertainty into action. By choosing to pay attention, seniors reclaim control over their health story. The silence of early symptoms is not a curse, it's a window of opportunity, a chance to act before damage is done, a chance to live with strength rather than reaction. A chance to age with dignity, awareness, and confidence, knowing that health is not defined by age, but by attention and care given at the right time. As we come to the end of this conversation, remember this: your body is not failing you, it's communicating with you. Even after 60, it still knows how to heal, adapt, and regain balance when it's given patience, attention, and care. You don't need to change everything at once. You don't need perfection. What truly matters is consistency, choosing small, supportive actions day after day, listening to subtle signals and responding with kindness instead of fear. A short walk, a routine checkup, better sleep, a nourishing meal, a moment of calm. These quiet choices slowly rebuild strength, clarity, and confidence from the inside out. Health at this stage of life is not about chasing youth. It's about protecting independence, preserving energy, and honoring the life you've lived while preparing for the years ahead. Every mindful step you take today creates momentum, not pressure, not urgency, just steady progress toward feeling stronger and more grounded tomorrow. If this message resonated with you, stay connected, subscribe, and come back for the next chapter. This journey isn't about endings, it's about continuing forward, wiser, calmer, and fully present for what comes next.